I went to PA school not knowing what I wanted to do. Never thought that I would want to do OBGYN. And it was really my clinical rotation at the Washington Hospital Center in DC. And the PA students worked really closely with the residents, which was an outstanding experience. We had to take call with them. I mean, we were elbow to elbow with them. And there was this one resident who she and I just clicked. And I knew that's what I wanted to do. And I loved that, that intuitively she knew what I could do and what I could help her with, which I loved. But I didn't go into OBGYN right out of PA school because I had a National Health Service Corps scholarship that I had to pay back. So I had to go to an underserved area and work in family medicine. So I didn't get to go right into OBGYN, but it was always kind of in my heart, that was my love. But my National Health Service Corps scholarship brought me out to a rural part of Central California, not the pretty California that we see in the movies and in commercials. And so I did that for a few years. And then after I fulfilled my commitment, I went to work for a large multi-specialty family practice group. But they also had somebody from internal medicine there and somebody from pulmonology and all these different subspecialties. Well, they also had OBGYNs there. And I would just kind of gravitate towards them. You know, at lunchtime, I'd go down and hang out with them. And one day they took me out to lunch and said, "We know this is what you want to be doing. Why are you down there in family medicine when you could be here with us doing what you want to do?" So that's kind of how that all began. I say this to students a lot. There's so much more to OBGYN than performing PAPs and breast exams. It's so much more. I had patients who would see me really for their primary care. And because PAs are trained in the generalist model, we're well equipped to handle pretty much everything that walks through the door. Rashes, acute problems. I did all kinds of stuff. I did a little bit of derm, I did a little bit of asthma management, diabetes management, hypertension management, a lot of that primary care because the patients will come to trust you and know you, and they don't really want to go to anybody else. And so, I would be able to manage them within the scope of my practice. And if somebody needed a referral to a cardiologist or a pulmonologist, then I would say, hey, at this point, I really need to refer you on. And a lot of times they said, I don't want to go on anybody else. I want to stay with you. And so again, I just think that's such an incredible opportunity for us as PAs to work in that area of medicine and to really add value to OBGYN practices, because we can do everything. And other, we go back and forth with the words we use to describe PAs and NPs, but other advanced practice providers are really very limited. In an OBGYN practice, they only do OBGYN. We can do everything. And so I've told that to physicians as well. It's a value added to your practice because we can see your patients for pretty much everything. Taking care of patients who don't have resources, who are either homeless or on the verge of becoming homeless, who live in socially insecure environments. When you're their healthcare provider, you really have to look at everything they're dealing with. Patients who can't afford to go get their prescriptions, or patients who don't make their prenatal appointments, not because they're being defiant, but because they have no transportation. And so it really forces you to look at those social issues head on. 25 years ago, when I was first starting out, nobody talked about the social determinants of healthcare. And so, now it's like every article you read, it's social determinants of health, social determinants of health. Back then, we were in the trenches. And, there's certainly a level of fatigue that occurs. They call it compassion fatigue, when, you see the same people over and over again. We had a high volume OB practice. I was the only PA with two amazing altruistic physicians. And there were some months when they would do 100 deliveries a month, which is ridiculously, I mean, that number is crazy high. And so it was very, very busy. And I remember one day we had a patient who set fire to the garbage in the bathroom. And then later that morning, I walked into the room to see a patient, and she had let her toddler go to the bathroom on the floor, and it just kind of hit me, I need a break from this. And so I went to work for a boutique practice for a few years and realized the grass isn't always greener on the other side. Perfect world, every OBGYN practice would have at least one PA. I would love to see more practices use PAs, not just in the office, but in the OR as well. So I had the opportunity, I was very fortunate, again, being the first PA to work in OBGYN in my entire county in California. And that county is about as big as, I don't know, New Jersey. I mean, it was a huge county. So I was able to first assist and attend to deliveries. You know, it was a really cool experience. And so I would love to see more PAs have those opportunities.